For more on this, let's bring in Dr. Theodore Strange. He's the interim chair of medicine at Staten Island University Hospital. Dr. Strange, thank you so much for being with us. As we previously mentioned, the U.S. recorded more than 2,800 deaths from COVID-19 on Wednesday. That is a new daily record. Why are we seeing such a sharp surge right now?
So I think with people going back inside, the weather changing, although I guess in areas like California, I'm not sure, I don't live there, the weather is pretty good. People not following what we should have been following all along and wearing the mask, socially distancing, washing our hands, and staying away from people if you're ill or have any symptoms is paramount to getting this disease back under control. And I think you just recently
Yeah.
spoke to Dr. Fauci, and I think he's been right all along here.
You know, it is interesting to hear you talk about California because it does make you wonder what's going on, given that they're now imposing this new stay-at-home order for parts of that state where intensive care units are almost at capacity now. I wonder, Dr. Strange, what you are seeing at your hospital. Do you think that more states could or should take a similar approach as what California is doing now?
So Staten Island is seeing a resurgence. We had recently up to a 6% positivity rate out here. We have about 500,000 residents on Staten Island. Our hospital right now is at about 160 some odd patients in the hospital. That's markedly less than April and May, and thankfully not as many people as ill, meaning being on respirators or in critical care, although we are seeing some very seriously ill patients. We are concerned because of the Thanksgiving holiday and some of these protests, as you just broadcasted, that these could be potentially super spreader events. But we are prepared at Staten Island University Hospital and Northwell Health to care for every one of these patients. We've made plans to have contingencies in place. We've opened up a separate field hospital next to our hospital to care for those that are a little bit less ill but still need and require inpatient care. And in doing all of that, we are still caring for everybody else that needs care on Staten Island in terms of their heart disease and their neurological diseases and any other diseases that come to us. So we learned a lot in the first pandemic, and we are here now to continue to treat this second phase, but to continue to treat the community at large.
You know, Doctor, I am curious what you thought when you saw some of those images of people protesting, given what it is that you have witnessed on the front lines of this pandemic.
You know, you just wonder, and I understand, business owners and people with small businesses are really feeling the pain, and I get that. But I have to tell you, just come to our hospital, come into one of our ICUs. And if you would have seen what it was like back in April and May, and we only hope that we do not get to those numbers again, you would say, is it about health or about wealth? Again, we want society to move on. We want our businesses to succeed. And I think we can do both. And doing both means being smart with common sense, wear the mask, be socially distant, limit the capacity in some of these venues, restaurants, bars, places of worship. I don't want to see my church closed, but we can't be in weddings that are with huge amounts of people, and we just need to be smart about getting out of this. The light's at the end of the tunnel here. The therapeutics and the vaccines are right around the corner. We're about ready to turn the corner on this, but we can't do that and also have a huge second wave here and not have learned from the pandemic of 1918, where the second wave was worse than the first. We just can't do that.
Let me ask you about vaccines. Pfizer reportedly plans to ship just half of its vaccines due to supply chain problems. Vaccine developers said some of the early batch of inoculations were not up to standard. Do you have any concerns, Doctor, about this rollout?
So there's always concerns. This was done very quickly, more quickly than any other vaccine program that has been put forth. But in saying that, I think there has been controls here. And I believe in our FDA and I believe in our processes, but we also need to move quickly. This will be rolled out with a lot of monitoring in place, and we'll have to watch and see. Again, we're always concerned about the benefit versus the risk, but clearly, I think in this particular circumstance, we believe the benefit will outweigh the risk. But in saying that, we will be very cautious and be very diligent and be very aware of what's going on around us as we continue to roll out these vaccines.
Well, earlier this week, the head of the Trump administration's vaccine push, Dr. Moncef Slaoui, said 10 to 15% of volunteers who have received Pfizer and Moderna vaccines are reporting, quote, significantly noticeable side effects. But what do we know about these side effects that Dr. Slaoui talked about? 10 to 15% of volunteers, he said, who have received Pfizer and Moderna's vaccines are reporting these, quote unquote, significantly noticeable side effects.
So again, the side effects can be anything from local swelling and local tenderness in the arm. They did report somebody with a transverse myelitis, I guess, in one of the studies in England. I think again we're going to have to be aware of what these side effects. Transverse myelitis is a neurological issue that affects nervous system, motor conduction to the lower extremities. So we're going to have to be aware. Any vaccine that we've seen has the potential for causing local swelling, local reactions to the point of even causing some fatigue and myalgias and fever. Again, the balance there is that if we can create immunity in our community to such an extent that we can prevent the continued spread into the community of this, and then somehow down the road create the herd immunity effect that everybody's looking for, minimizing the death rate and the number of patients who are needed in a hospital. That's really what this is all about.
All right, Dr. Theodore Strange, I know you and your colleagues have had some very long days, long months. Thanks to you and to your colleagues for everything you do, and thanks very much for your time tonight, Doctor.
Well, thank you for getting the word out there. And again, let me just say, wear the mask, be socially distant, be smart about being in large crowds, and if you're sick, stay home. That's the message we need to keep getting out there. Thank you for spreading that word.
Thank you.